Welcome. We're here at Teton Therapy with Brian Allred. And Brian, what are your credentials?
I'm a physical therapist and co-owner of Teton Therapy.
Wonderful, wonderful. Brian wanted to talk to us today about gait and balance and how so important that is for preventing falls.
Yeah, I see a lot of people in here for falls. It's one of those things that usually we don't realize is a problem until after it's a problem, until we have a fall. One of the big things that we're always nervous about with a fall is a broken hip. Now there's a lot of injuries obviously, but a broken hip is correlated with a 6-month mortality rate, which means that 50% of people after a broken hip are dead within 6 months. Now that's not because of the fracture itself, but because everything else gets so hard and things start going downhill. So we really want to prevent that rather than being reactive. A lot of times when people come in to see me for their balance and falls, some of the first things that we want to work on is the low-hanging fruit. We want to fix the environment. So if we go to visit somebody's house for a home assessment, we might look at the floor and say, hey, we need to get rid of some of these throw rugs. They're a tripping hazard. A lot of people have extension cords running across the floor, another tripping hazard. Pets can be, but usually people are a little bit more hesitant to get rid of them.
Sure, that makes sense.
Some of the other things that can help as far as the environment goes is just making sure that we have good lighting. If you get up to go to the bathroom in the middle of the night, you probably don't want to turn on all the lights, but if there's no light, you're more likely to catch your toes on something that you don't see and take a spill.
Sure. And what about your attire? What are some problems there?
Good footwear. I'm always a little nervous when people come in wearing sandals during the summer. They, especially if you're in that age range where falls are a concern. Another thing is good fitting footwear. I was just saying earlier, Peter had a patient recently who was coming in. The doctor sent her here to work on her balance because she'd had a lot of falls, and when Peter tested her balance, it was great. Finally, he figured out it was her shoes that were about 2.5 sizes too big, and she kept catching the toe every time she'd take a step.
Sure, that makes perfect sense. And are people receptive to making those kinds of changes, do you find?
Oh yeah, a lot of times with footwear, for example, once people realize that it's an issue, that it's easy to fix. They don't do it because they know it's an issue, they do it because they don't know.
Sure. And then what about the gait?
So the gait cycle is one of those things that you learn how to walk when you're about a year old, and then you probably never think about it again until there's a problem.
Sure.
But it's a very complex cycle. A lot of muscles that have to fire at exactly the right time. Your weight has to shift just right. And if, for example, if balance isn't good enough, our gait changes to adapt to that. So I'm sure we've all seen this. Someone who's a little older, we tend to have a wider base of support. We decrease our center of gravity. We might hold our arms out and stop swinging them. And that's great if you're walking on ice because that's our body's natural reaction to walking on ice. But if it's just because your balance is poor, now we're taking shorter step lengths, so it's a lot harder to get around. You're more likely to catch your toe because you're not picking up your feet the same way you normally would. And so then what we want to work on is improving balance so that we can get that base of support narrower, get people standing taller. They feel better too. Nobody wants to walk around like a little old lady. So they always feel better when they're walking faster and taller and more confident.
Absolutely. And then what do you think about assistive devices?
A lot of times when people get an assistive device, the doctor says, hey, I think you should use a cane, and then nobody teaches them how to use a cane. So they go to a hospital pharmacy or to the hub and pick up a cane, and they don't know how to size it to themselves. They don't know how to use it. If you're using a cane or a walker for that example, it should be about at the wrist crease if you're standing tall with your arms at your side. So that means when you're holding it, you have just a little bit of bend in the elbow. If you're using a cane, you want it to actually be on the opposite side of the side that is sore or weak, which seems counterintuitive, but then you get that normal arm swing and it shifts your weight away from the bad side instead of towards the bad side. So if we've got a cane here, I would want to put it down with my left foot and with the cane in my right hand, and then I can step through with the other side. Yeah, it's just one of those things. Again, we don't think about till it's a problem, and then when we try and fix the problem, we don't know how.
And if we're trying to fix it sometimes without someone's help, such as yourself, with the training that you've had, then maybe we're training those muscles incorrectly.
Exactly, yeah, sometimes I'll see people in here who've had a cane for 40 years, and then when I try and teach them to use it the right way, they understand, when I teach them why, they understand why it needs to be in the opposite hand or whatever they're doing wrong, but it's something they've been doing for a long time. It's really hard to change something you've been doing for that long.
Sure. And so what kinds of things, how do you know when it's time to maybe come seek some help?
If you notice that you're starting to do things differently, if you're saying, ooh, I would like to go out, but I'm afraid of falling because there's ice on the sidewalk, where normally you wouldn't be afraid of that. Or you're staying in bed longer because you're nervous getting up because you feel a little weaker first thing in the morning. Anytime you're doing things differently because of your weakness or balance or whatever, that's the time that you should get it looked at. Again, don't wait till after it's a problem.
Perfect. And how easy is it? What type of time commitment is this to come and see a therapist and put the work in?
Treatment, of course, is very dependent on what you're coming in for. As far as getting in to see us, it's pretty easy. Wyoming is a direct access state, which means you don't have to have a doctor's referral to come see a physical therapist. You can just call Sonia and get on the schedule. Now, most insurance companies do require a doctor's referral. We can help you get that if needed. And then it's just a matter of coming in. We'll find out what's wrong. And if you're the lady that has the big shoes, then it's pretty quick and easy. We just say, hey, let's get you some shoes that fit. More often it's a matter of balance or weakness, and it takes a little while. They say about 6 weeks to really increase strength. Balance can come a little bit quicker than that if that's the problem.
But 6 weeks?
Yeah, it's not too bad, and we try and make it fun.
Well, good, I can see that. I don't know if anyone can see, maybe we can pan up to the ceiling here at Teton Therapy.
Every Friday is Disco Friday.
So, thank you so much, Brian. We really appreciate your time, and you all just do a great job here. I know you're taking care of some of our folks, at the hub that come to exercise classes, as are some of the other physical therapists in town. So we just have a lot of great options, but certainly Teton Therapy is one of them. And thank you again, Brian.
Thank you.